So welcome back guys to my channel. I've introduced myself. My name is Dennis. I'm a nursing officer by profession. I want to talk about neonatal sepsis. That is sickness of the neonates. So first we need to understand who neonates are. There are babies, there are infants, but I want to address specifically the neonates, the just born babies. So neonates are babies born and the ages between the how old is a neonate? Neonate is between 0 to 28 days. So that is whom we call a neonate. A neonate is a baby born and is between 0 to 28 days. Remember, they are very young, their immunity is very weak, so they are prone to getting ill. And we want to uh, discuss that, what is known as neonatal sepsis. Sepsis is just illness that affects your neonates. So in this course, we will be discussing about the causes of neonatal sepsis. We have early onset of neonatal sepsis, late onset of neonatal sepsis, manifestation of neonatal sepsis. How can you know that your baby has sepsis? And also, how can you manage neonatal sepsis when you are at home or even in the hospital setup? Management of neonatal sepsis. And also, how you can treat neonatal sepsis. So welcome guys to my channel. Interact with me in the comment section. You can ask questions, I will respond. I'll be glad to interact with you. So let me begin with explaining what neonatal sepsis is so that you can understand, all of you, what I'm talking about. So at this point, we have microorganisms. So microorganisms are disease-causing agents. So you can find that in this neonatal sepsis, the microorganisms get into the bloodstream of the neonate. So when these disease-causing organisms get into the blood system of the neonates, they can cause what is known as septicemia. They can also manifest as pneumonia. Even in some cases, it can manifest as meningitis, osteomyelitis, and even arthritis. So my explanation of neonatal sepsis is when the microorganisms enter into blood system of the neonates and manifest as septicemia, pneumonia, and meningitis. So when you have that baby, you should always watch for these manifestations. So I'll take you one by one. How does it occur? I talked about the early onset of neonatal sepsis and the late onset of neonatal sepsis. So what do you mean by early onset and the late onset? Remember, this is about the timeline. So let me begin by the early onset of neonatal sepsis. In early onset, it occurs within 72 hours of birth. So normally it can occur within 72 hours in the hospital setup. So within 72 hours, that is within 3 days of birth. So at this point, remember when you are giving birth or in the hospital, giving birth, that procedure should be handled with to reduce in manner that you reduce chances of getting infection, that is both to the mother and to the baby. So as a nurse or as a medical practitioner, you always observe a septic technique to ensure that you reduce the chances of infecting the mother and also the baby. So we normally have sterile equipments. We have surgical gloves to use at this point so that you minimize introducing microorganisms to the baby and to the mother. So at this point, there can be presence of microorganisms at the genital. So welcome, guys. Tell me from where you're watching me from. Let's interact and ask me questions. So these organisms in the genital tract, they can be different types of organisms. One of them is, we know, one of the most common one is the E. coli. So E. coli is from the GI system. Remember, when you are giving birth, you are, there is the baby can come into contact with the fecal matter, because when the baby is coming down, the baby exerts pressure on the rectum, pushing out the fecal matter as well. What is we normally say the first twin. So this fecal matter, when the baby come into contact with them, that microorganism, the E. coli, can get into the baby's system and cause sepsis in the later hours. We also have group B streptococcus. These are a group of microorganisms. They can also be found in the genital area. And during birth, the baby can get into contact with them. I've also talked about the unsterility during birth. So the birth attendants are always advised to observe sterility at the highest level to reduce chances of introducing the microorganisms to the baby and to the mother. So that is the early onset of sepsis. We also have late onset of sepsis. So this late onset, it starts after 72 hours or even more. So the early onset, I said within 72 hours strictly, while late onset is at 72 hours or even more. So remember, for these microorganisms to be present in the genital area, there are some of the risk factors that you can put the baby at risk. So one of these risk factors, we have what is known as premature rupture of membranes. When you had rupture of membranes before onset of labor, what is known as water bag in layman's language. So when that water bag bursts before the onset of labor, it can also be a risk to getting infection. That is both to the mother and to the baby. Another one is prolonged labor. When you have prolonged labor, there's also high likelihood that you can also increase the chances of infections. So prolonged labor is labor that, for example, we have the multiparous mothers. Multiparous mothers are the ones that have given birth more than once, and the preemies, the one who are giving birth for the first time. So for the preemies, for you to have a prolonged labor, that labor is going to take more than 18 hours and is not progressive despite the full dilatation of the cervix. And in the multiparous, the ones that have given birth more than once, they will have, for them to be said they have prolonged labor, the labor might have lasted for more than 12 hours. So if you have prolonged labor, then you are also increasing the chances of having sepsis to the baby. Another one is multiple VEs, which is known as vaginal examinations. So for those who have gone to the clinics, when you are in labor, there is something called vaginal examination, which is done periodically to assess the progress of labor and the dilatation of the cervix. So when you have multiple VEs, You also increase the chances of introducing the microorganisms to the baby or to the cervix, which can later cause sepsis in the baby. So those are some of the risk factors that can cause sepsis, that is under early onset of sepsis. So I was talking about late onset of sepsis. That starts with at 3 days, at 72 hours, or more than 72 hours. That one is late onset. So what microorganisms? So in the late onset, we also have microorganisms that are likely to cause sepsis. One of them is Staphylococcus aureus. These are now the common microorganisms. Another one is the E. coli that I said earlier. E. coli can cause early onset of sepsis and also late onset of sepsis. We also have Klebsiella species. That's one of the microorganisms that can cause sepsis. So for those who are joining right now, I'm talking about the neonatal sepsis. And this is sickness of the neonates. I've said neonates are those babies between 0 to 28 days. They are very fragile. We have to be very keen in taking care of them to ensure that we minimize uh, having them getting infections. So I hope this tutorial will be very helpful to the mothers in general, the young mothers, everybody who is coming into contact with the babies, even the healthcare professionals at the hospital, so that we reduce the neonatal mortality rate. So sepsis is one of the leading cause of neonatal mortality. It kills so many babies, and will not. These are preventable condition. Sepsis. It's a preventable with something that we can observe: hygiene, sterility, and reduce the chances of having our babies die because of sepsis. So kindly welcome to my live stream. Interact with me in the comment section. Tell me where you're watching me from, and I'll appreciate your support. And also, don't forget to subscribe to my channel. If you are new here, you've come across me, kindly support me by subscribing to my channel. Let me reach even 1,000 subscribers. And always watch my videos for more information, because we want to achieve maximum health. There is no way our babies are our future, so we have to ensure that they are healthy. Yes, so they are our future tomorrow. So kindly support me, and I ensure that I will always give you more information on every condition you want to hear. Yeah, I want to educate our mothers, everybody across all colors, so that we ensure that we have maximum health in our society. So what can I'm talking about the under the late onset of sepsis, there are also risk factors that we have to look at and ensure that we minimize this risk to reduce onset of sepsis at the later stages. Maybe the baby did not get the sepsis while in the hospital, but this one can occur even at home. So which are the fetal risk factors that can cause late onset of sepsis? One of them is low birth weight. Low birth weight is weight below 2.5 kilograms. So remember, these babies, their immune system compared to the ones with the normal birth weight is different. They are always at risk to so many conditions. One of them is sepsis. So when your baby is below 2.5 kilograms, there is a high risk factor that we normally look into, and these babies, there are special care that they are normally given to ensure that in general, because we also have other diseases that come along with conditions that come along with low birth weight, like jaundice. So we ensure that they don't get these conditions by giving maximum care to them. Another one is intrauterine growth restrictions. So when the baby has intrauterine growth restrictions, the baby is not developing well into the while in the uterus. So what can cause this intrauterine growth restrictions? One of them is the baby is not getting good nourishment. Maybe there is a problem with the placenta. Placenta is that organ that provide nutrients from the mother to the baby. So when there's a problem in the placenta, they can also, that one can cause intrauterine growth restriction, and also poor oxygen supply through the umbilical cord. Yes, so those are some of the factors that can cause intrauterine growth restrictions. So that is also a risk factor to sepsis at the later stage. We also have preterm babies. So preterm babies are babies born before time. Remember, you should give birth after 40 weeks. So when a preterm baby is a baby born before 37 completed weeks. So they are also at risk of neonatal sepsis, and we also ensure that they are also almost of the same category with the babies with the low birth weight. Many times they are born with low birth weight and other factors. So these preterm babies, they are also at risk of getting sepsis. And lastly, lack of breast milk. To the mothers, we know the importance of breast milk to the baby. The babies, their immune system always depend on the breast milk. The breast milk boosts their immunity. So when you don't have breast milk, it means that because in the breast milk we have those cholesterol that provides immunity, boosts the immunity of the baby. So when you lack breast milk, it means there is no much that can help the baby to boost the immunity. So those babies will also be at risk of getting sepsis at a later stage. So tell me guys where you're watching me from. Let's interact. Kindly subscribe to my channel. I'll appreciate for every little support you accord me. Before you go, just take a second and click that subscription button. Put on the notification bell and ensure that every time I upload my content, you be the first one to watch and get informed. Here I teach you, I give you free education at the comfort of your home. You just watch me at the comfort of your living room, bedroom, and we achieve the common goal of being healthy. So in this, in my definition of neonatal sepsis, it has three major presentations. It presents in three major ways. One, we have general sepsis. Secondly, it can present as pneumonia. And thirdly, as meningitis. So I'll tackle them one by one. When your baby has sepsis, pneumonia, or meningitis, how will the baby present? So that one brings me to clinical manifestation of neonatal sepsis. I've said it presents in three ways: pneumonia, general sepsis, and even meningitis. So when the baby has general sepsis, that is general sickness, how will the baby present? One of them is alter. So welcome new people in the house. I'm talking about neonatal sepsis, and at this point I'm going to discuss about the clinical manifestations. So the first one, when the baby has general sepsis, one of the early symptoms will be alteration with the feeding behavior. So that is breastfeeding. The baby will be poorly breastfeeding. The baby will refuse to breastfeed or have poor sucking reflex. The baby will not have the energy of sucking the breast. So you'll automatically observe and detect this, because when the baby refuses to feed, it brings it makes the mother to be worried, because remember, these are young baby. So it is the responsibility of the mother to ensure that the baby breastfeeds. So when your baby refuses to breastfeed or breastfeed poorly, as a mother, you will be worried. So at any point you see your baby having that change of behavior in breastfeeding, one of the things that can come into your mind is neonatal sepsis. Another one is poor cry. You know, the moment your baby is born, there will be that, you'll know how your baby cries. So there are these very weird types of cry that you will observe as the mother. There will be obvious change in cry, and it will be very poor, very strange. It will even scare you as the mother. Yes. And also vomiting. You know, vomiting, uh, uh, this one will also can be a manifestation of neonatal sepsis. The baby vomiting. Vomiting is not a good sign, because the baby will be losing a lot. He'll be losing the milk he has sucked. He'll be losing a lot of electrolytes, so the baby can easily die of vomiting. So when you see the baby vomiting and is not usual, kindly rush to the hospital. Let the baby be helped. Another point is also hypothermia. Hypothermia is low body temperature. You'll feel the body's the baby's temperature is even before at home. You can feel the temperature of the baby is very low. The baby is cold. So hypothermia is one of the things that these babies, remember, their mechanisms of controlling body temperature is still very poor. So we ensure that as the young mothers, keep your baby warm, always warm. Don't expose your baby too much. And also, you have to manage between hypothermia and hyperthermia. Hyperthermia is high body temperature. When your baby has high body temperature, you expose, but not too much. You expose with moderation. So hypothermia can easily kill the baby, because it will reduce the physiological mechanisms, a lot of physiological mechanisms. That is even the oxygen level. So at these babies, at this point, when they present with hypothermia, I've said about the poor cry, the vomiting. As a mother, you must be worried. But in the facility, this one can easily be detected, and your baby will be helped. Babies can also present with apneic spells. So apneic spells, these are period of so at this time the baby can pause breathing for some seconds. So the baby just pauses breathing for some seconds. So that is called apneic spells. So it can be for around 15 to 20 seconds. That is a long time for the baby, because that one will also affect the oxygen level in the body when the baby is pauses frequently for during breathing, pauses to breathe for 15 to 20 seconds. Yes. Thank you for those who are watching. Tell me, let me recognize you by commenting down below. Let me recognize you and appreciate your effort, your time, to ensure that you are with me at this point. Another manifestation of general sepsis is abdominal distension. You'll feel that the abdomen of the baby has distended. So from my people, you know, tunasema tumbo ya mtoto imefura. So when the abdomen is distended, the baby will not be comfortable. Yeah, even breathing wise, the baby will not be breathing well. And lastly, the baby will be lethargic. Lethargy. The baby will be tired. Will have no energy. So lethargy is also, these are signs. We call them some of the danger signs in the neonates. So when you see your baby lethargic, has no interest in feeding, the baby has no energy to breastfeed, then it can be as a result of neonatal sepsis. And then I said the baby can also present with pneumonia. So how can you know that your baby is presenting with pneumonia? So one of the presentation under pneumonia is fast breathing. Your baby will be breathing fast. So as a mother, the mother is the first caregiver and the first doctor of the baby. So any little change in the baby in terms of breathing, you'll be able to detect. So if the baby's breathing rate has changed to be faster, that one can mean that the baby has pneumonia. Another one is chest restrictions. You will observe chest restrictions in the baby. What are chest restrictions, and how can you know that your baby has chest restrictions? Kindly comment down below. Tell me where you're watching me from, and let me appreciate you for sparing your time to be in my life. So chest retractions is abnormal breathing. So you will see the chest wall, what is known as the chest muscles will be pulling the skin. Yes, you'll see the chest muscles pulling the skin around the bones, and the baby will be breathing abnormally, while the chest muscles pulling the skin around the bones. So when the baby just lies, you'll just see the chest retractions, the chest muscles pulling the skin around the bones. You won't see the bones aligning under the skin, and the baby is struggling to breathe. And lastly, how you can observe, know that your baby has pneumonia is grunting. Grunting is some weird cry in the baby. Uh, it's noisy breathing sound. I don't know how I can explain that noisy breathing sound. It's you feel some pitch in the breathing, the noisy breathing sound. That is called grunting. So at that point, the baby will be trying to keep the air in the lungs. That is why you will feel the baby grunting, making that noisy breathing sounds. So I've said 3 points under pneumonia. One of them is fast breathing. Another one is chest restrictions. I've said restrictions, the chest wall, the chest muscles pulling the skin. And lastly, baby grunting. Grunting, I've said, is the noisy breathing. So this one will worry you as the mother. when the baby is having noisy breathing, because the baby is struggling to keep the air in the lungs. And last manifestation is meningitis. So meningitis in neonates does not have distinct manifestations. Remember, as an adult, in meningitis in neonates is not very easy to diagnose like in adult. In adult, we have distinct manifestations like photophobia. You don't want to have light around. That's severe headache, neck pain. So you will not be able to detect such distinct manifestations of meningitis in neonates. So that one will be done, can be done through various tests in the hospital. But as the mother, those three factors, that is pneumonia and also sepsis, you can obviously see changes in the baby, and take your baby to the hospital. Allow your baby to be helped so that we prevent unnecessary deaths of our young babies. Welcome, guys. Kindly subscribe, give me a thumbs up, comment down below, tell me where you're watching me from. Support me, guys, and I'll appreciate. So, how do you manage, or what is the treatment of neonatal sepsis? Treatment of neonatal sepsis? Yes. But before that, we can also, when you are in the facility, what are some of the investigations that can be done to ascertain that the baby has neonatal sepsis? One of the investigations is what is known as sepsis screen. So sepsis screen contains for around how many factors? Around 5 factors. One of them is total leukocyte count. We also have absolute neutrophil count. So total leukocyte count, you will find them, it is low. Absolute neutrophil count will also be low. So we also have C-reactive protein will be positive. C-reactive protein. So this one is not also for the medical practitioners. The C-reactive proteins will be positive. So those are some of the factors we look at in sepsis screen. Another investigation that can be done is lumbar puncture. So lumbar puncture is only done when you suspect the baby has meningitis in high risk neonates. So this one is not usually done, but only done when you suspect meningitis in high risk neonates. So high risk neonates, I've said we have low birth weight, preterm babies, the babies with the intrauterine and growth restrictions. Those are high risk babies, and if you suspect that they might be having meningitis, then you can go ahead and do lumbar puncture, but it's not usually done unless you have suspicion. And then treatment of neonatal sepsis. How do you treat neonatal sepsis? So we have principles of treatment of neonatal sepsis. So we have supportive care. This one is not necessarily use of medications. But remember, I talked about hypothermia. Neonates are always at risk of hypothermia. And at that point, we should always keep them warm. Keep your baby warm. And monitor changes in temperature. if need be, then you can expose a little if the baby has hypothermia, increased body temperature. But keep your babies warm in the hospital, because when the babies have pneumonia, sepsis, their oxygen level tends to drop. So we give them oxygen therapy to support the oxygen level, the normal oxygen level in the blood system. Another one is also infusion with ringas lactate or normal saline. So there are always calculations on how you can the amount of ringas lactate to be infused in the to the baby, and also put the IV line the baby for these processes like infusion of ringas lactate, and finally the nutrition. Remember, these babies, they have poor feeding, they have also they can vomiting. So ensure that if the baby cannot breastfeed, ensure that we have the NG tube in situ to support the baby. You can express breast milk and give through the NG tube, because that is very important. The babies, they need that to ensure that they have effective growth. So I've talked about supportive care that entails warmth, giving oxygen, infusion with the ringas lactate and normal saline or normal saline, and nutrition. We also have specific care. So specific care, this one involves antimicrobial therapy, the use of drugs. So we have approach considerations. So approach considerations, we have stable neonates and unstable neonates. So in stable neonates, we do the supportive care. You can also do the screening. So the stable neonates and the unstable neonates. So we have we have high risk neonates and low risk neonates. So under high risk neonates, we have stable and unstable neonates. So for the stable neonates, do the supportive care. For the unstable neonates, we have the ABC, maintain airway, breathing, and circulation, and use antibiotics. So antibiotics of choice, we have antibiotics of choice for treatment of pneumonia and also for the treatment of meningitis. So the duration of antibiotic therapy, for the symptomatic babies, you do give antibiotic therapy for 7 days. That is if screening is positive and culture. Remember, you can under investigation you can also do the culture. So if screening is positive and culture is negative, do antibiotics for 10 days. If culture is negative, you do antibiotics for 14 days. And in case of meningitis, then you do antibiotics for 21 days. So that is the duration of antibiotic therapy. Then how can you know that? I was talking about also the choice of antibiotics, kindly. Remember, under the choice of antibiotics, we have ceftriaxone. Ceftriaxone is not given to neonates. Ceftriaxone not given to neonates. So under the guideline of ceftriaxone, remember, before you give a drug, you always read the instructions. So ceftriaxone not given to neonates. The most preferred one is gentamicin, which is given a BD dose in neonates. That is 2 times in neonates. Another one is we have Xpen and gentamicin. So Xpen is the one given BD dose, that is twice a day in neonates. That is 50,000 international units per kg of body weight. While gentamicin, so for gentamicin we have to categorize we have categorize under the under weights of the baby. So we have those below 2.5 kilograms and the neonates above 2.5 kilograms. So gentamicin given is given 2. That is 3 milligram per kg for those who are below 2.5 kilograms, and 5 milligram per kg for those above 2.5 kilogram. So let me repeat at that point. Gentamicin for neonates below 2.5 kilogram give 3 milligram per kg, while neonates above 2.5 kilogram give 5 milligram per kg. And I've said in there that do not give ceftriaxone to neonates. Diazepam is also not given in neonates. Yes. So how can you prevent neonatal sepsis? The prevention of neonatal sepsis. Because as a mother, as a healthcare practitioner, prevention is always better than cure. So we should learn how to prevent these problems before they come in, because treatment is always very expensive. So we had always advise mothers, nurses, doctors to protect the babies from getting neonatal sepsis. One of them is because when we started, one of the risk factors was unsterility during delivery. So how to prevent this is observe strictly sterility during delivery. If you breach sterility, always be sincere. You can always start again so that you prevent unnecessary introduction of microorganisms to the baby and to the mother. Another one is for the mothers, always prevent and treat infection in the mothers. So if a mother is sick, for example, a mother has UTI and other infections, they should get proper treatment before delivery. Before getting proper treatment, if they can prevent such infections, it's better. But prevent and treat mothers who have infections. And also, we can also give prophylactic antibiotics in case there is history of neonatal sepsis. If a mother has babies who have history of having neonatal sepsis, you can give antibiotic prophylactically to prevent the baby from getting sepsis. If there is that group B streptococcus colonization, you can also give antibiotics, and also give antibiotics in case of chorioamnitis. Yes, chorioamnitis. So you are allowed to give prophylactic antibiotics to the mother in case of such factors that I've mentioned above. So for those who are joining me now, I was thinking about neonatal sepsis. I've talked about the causes of neonatal sepsis, the early onset and late onset of neonatal sepsis. How does babies present? How do you treat? Investigations done to ensure that you are certain the baby has neonatal sepsis. Treatment of neonatal sepsis. Drug that should not be given to neonates. And also prevention of neonatal sepsis. So as a mother, you are always the first caregiver of the baby. You are the person who should be able to detect any problem early enough in case the baby has, so that a baby has children, they have right to health care. So as a caregiver, your duty first is to ensure that your baby has gotten the necessary healthcare services, among other needs that you should be giving as a mother. So I want to appreciate everybody who has been with me throughout this session. It was very interesting topic to discuss with you guys. I want to look forward for more of these sessions so that we interact in real time. You ask me questions and spread the gospel to mothers, because we are preventing such. We don't want to lose babies. We want to reduce neonatal mortality rate. Neonatal mortality rate is still high in Kenya and even in Africa. Low income countries, we still observe high levels of neonatal sepsis, or even neonatal fatality rate is very high. So we want to reduce that. Measures that we can put in place to ensure that our babies don't get neonatal sepsis, among other conditions. So I want to thank you guys. Before you move out, ensure that you subscribe, give me a like, and always stay tuned for more videos, for more topics of the same and also of different topics. So thank you guys. Until next time, let's plan to meet frequently. Tomorrow I will also be live from 4 p.m. So great time so that you join me live. Thank you. Until next time. May God bless you and have a fantastic evening.